Section 8, Chapter 31, Chemotherapy Drugs. Welcome to Section 8, Chapter 31. This is a very deep and diverse topic. We will discuss some of the main points about chemotherapy and the main drugs used. Even though this is a specialized topic, a general knowledge about chemotherapy drugs is important. Chemotherapy is used for primary treatment when the disease is advanced and with no other viable options. It is also used when a combined approach with surgery or radiation gives the best curative survival options. There is a very small list of cancers that can be cured with chemotherapy alone. Most of these are blood cancers. When chemotherapy is used with surgery or radiation, it may be before, during, or after these other modalities. The growth of a cancer cell can be the focus of an anti-cancer drug. This gives us a classification of anti-cancer drugs, cell cycle specific, CCS, or cell cycle nonspecific, CCNS. The cell cycles are S, DNA synthesis, G1, synthesis of cellular components for DNA, G2, synthesis of cell components for mitosis, and M, mitosis or differentiation. About 40% of the time is spent in S, 40% in G1, 20% in G2, and 2% in M. Examples of the S-phase drugs are 5-FU, cytarabine, clofarabine, methotrexate, and 6-thioguanine. An example of the G1S phase is etoposide. Examples of the G2M phase drugs are irinotecan and topotecan. Examples of the M phase drugs are paclitaxel, vinblastine, vincristine, and vinorelbine. An example of an anti-tumor antibiotic working in the M phase is bleomycin. Several cell cycle nonspecific drugs are altretamine, busulfan, carmastine, cyclophosphamide, lomustine, and cisplatin. Rarely are any of these drugs used as a single drug therapy. Drugs used in combination for chemotherapy consider several basic suppositions. 1. Each of the drugs have some activity against the cancer. 2. The toxic effects of the drugs are not additive if possible. 3. A dose schedule is as optimal as possible, with waiting time between doses only to let normal tissue recover. 4. Drug interactions between the chemotherapy drugs themselves is clear. 5. Dose changes of any of the combination drugs needs to assure they have not dropped below an effective threshold. Alkylating drugs, of which there are multiple groups, are cytotoxic by transferring the alkyl group to parts of the cancer cell. Resistance can develop by the usual methods: faster DNA repair, decreased transport of the alkylating drug, and increased conjugating compounds in the cancer cell, combine with the alkyl drug. Adverse effects are nausea, vomiting, damage to the bone marrow, GI tract, and reproductive organs. Antimetabolites have a focus that attempts to highlight slight differences between human cells and cancer cell metabolism. An example of this is in the antifolate group, methotrexate. Methotrexate is a folic acid analog that inhibits the formation of tetrahydrofolate, which several steps later hinders DNA and RNA synthesis. Methotrexate can be delivered orally, intravenous, or intrathecally. It is eliminated renally and needs a dose reduction in renal insufficiency. Aspirin, NSAIDs, penicillin, and cephalosporins inhibit renal elimination and should not be used with methotrexate. In an overdose situation, folate can be given to attempt reversal of methotrexate. Fluoropyrimidines are another group under the heading antimetabolites. One of these drugs is 5-fluorouracil, 5-FU. After several steps, a metabolite of 5-FU blocks the reaction necessary to form thymidylate. Thymidylate is necessary for DNA synthesis. 5-FU is used for the treatment of colorectal cancer. Dosing is by intravenous infusion. The body has a specific enzyme to metabolize 5-FU, dihydropyrimidine dehydrogenase. If this enzyme is not present, a severe toxicity can occur. About 5% of patients do not have this enzyme. Myelosuppression is a major side effect. Another group of antimetabolites is the deoxycytidine analogs. Cytarabine is one of these antimetabolites, which works on the S phase of cell growth. It is metabolized several times to end up ARA-CTP, which inhibits DNA polymerase A and B, stopping DNA synthesis and repair. Cytarabine is given intravenously over 5 days. It is used for hematologic malignancies. The side effects follow many of the cytotoxic drugs: nausea, vomiting, myelosuppression, and neurotoxicity. There is another group of antimetabolites called purine antagonists. They are metabolized to a form that inhibits enzymes involved in nucleotide synthesis. 6-mercaptopurine was one of the first of this group. There are many cancer drugs in the group of so-called natural drugs. Like many antibiotics, they come from plants. Vinblastine is one of these drugs. Vinblastine works on the cytoskeleton by inhibition of tubulin polymerization. Mitosis is arrested and cell division is stopped. Vinblastine is metabolized by the liver and eliminated in the GI tract. It is used in breast cancer and in Hodgkin's disease. A large group of natural cancer drugs come from Streptomyces pucitius varcaceus. They are called anthracyclines. Doxorubicin and daunorubicin are 2 examples of anthracyclines. These drugs work by many mechanisms, but their ability to generate high levels of free radicals in the tumor cells is the most cytotoxic. The host is not immune to the free radical effects, and cardiotoxicity is a significant side effect. Anthracyclines are metabolized in the liver and need dose reduction in patients with liver disease. There are also dozens of anti-cancer drugs that do not fit in any specific category. Conclusion: many of the anti-cancer drugs have an effect on the cancer cell metabolism. The area of metabolism that is affected gives the drugs a group classification. The goal of these drugs is to focus on slight differences in tumor cells, but many times the host is negatively affected by the chemotherapy drugs. The largest groups of anti-cancer drugs are the natural drugs and the drugs with no specific group. Key points. 1. Chemotherapy is rarely used alone as a treatment except in certain hematologic malignancies or when there are no other viable options. 2. Cell cycles are S, G1, G2, and M. 3. There are several suppositions that are considered when combining chemotherapy drugs. 4. Antimetabolites focus on certain segments of the cell cycle. 5. The main toxic effect of doxorubicin, forming free radicals, is also toxic to the host. Questions. Number 1. Chemotherapy is the mainstay of therapy in most cases. A. True. B. False. The answer is B. False. Number 2. Which of the following drugs works on the S phase of cell growth? A. Topotecan. B. Paclitaxel. C. Cytarabine. D. Cyclophosphamide. The answer is C. Cytarabine. Number 3. 2 chemotherapy drugs used together should have the same side effect profile. A. True. B. False. The answer is B. False. Number 4. Which of the following should be used in an overdose of methotrexate? A. Aspirin. B. Folate. C. Penicillin. D. Antacid. The answer is B. Folate. Number 5. Cardiotoxicity is related to which of the following chemotherapy drugs? A. 5-FU, B. Cytarabine, C. Vinblastine, D. Doxorubicin. The answer is D. Doxorubicin.